Hello there. Welcome to another installment on My Ultrasound Diaries. So on this day, I was called to scan an 11-year-old boy who presented with fever and recurrent abdominal pain precisely around the umbilical region. The pain sometimes radiated to the right iliac fossa. He was referred to our facility to rule out an inflamed appendix with the ultrasound. These are my ultrasound findings. Firstly, the liver, the two kidneys, the pancreas, spleen, and bowel all appeared sonographically normal. Even the right iliac fossa, where some tenderness could be elicited, showed no inflamed appendix. All of these inferences were made with a curvilinear probe. Before I concluded the exam and made an impression of what could have been a subacute appendicitis, I decided to take the linear probe to examine the area of tenderness, which was the right lower quadrant, a little bit further. I observed multiple hypoechoic lymph nodes within the right lower quadrant, anterior to the psoas muscle, and around terminal iliac bowel loops. These lymph nodes that were visualized demonstrated near to complete loss of hilar echogenicity and appeared enlarged. Some were discretely located and some were clustered together. More than 5 were seen. Lastly, while observing these lymph nodes, it was seen that at least 4 had short axis or AP diameters greater than 5 millimeters. This was enough to make a satisfactory impression, and here is my report. Multiple enlarged and hypoechoic lymph nodes with near to complete loss of hilar echogenicity are visualized within the right lower quadrant, anterior to the psoas muscle echoes. Identified lymph nodes had diameters greater than 5 millimeters. In my impression, ultrasound features suggestive of mesenteric adenitis. By this experience, I relearned that if a child complains of lower abdominal pain, especially on the right, and an inflamed appendix is not seen, always take your linear probe to look out for enlarged lymph nodes that may suggest its closest possible differential, mesenteric adenitis. Stay tuned for more ultrasound.